My mum always told me a mouth ulcer meant that I was run down or coming down with a cold, but is this the case? Let's find out. Dr. Amanda Poon-Nguyen is an oral medicine specialist. Good morning.
Good morning.
Doctor, I'm someone who tends to get mouth ulcers quite often. So can you tell me, do you know what causes them?
Yeah, so first off, I think we need to talk a little bit about what an ulcer actually is. So an ulcer is actually just a break in the skin in the mouth, and there are many reasons why people can get oral ulcers. Kids tend to get a type of ulcers called recurrent aphthous stomatitis, and it's pretty common among kids. They tend to grow out of it. Adults can get ulcers for a whole host of variety of reasons. They can be deficient in certain vitamins. It could be a medication-related side effect. It could be an intolerance to an ingredient, such as in toothpaste. Sometimes it can actually be a manifestation of a health problem. So people who do have gastrointestinal issues, for example, like Crohn's disease, they can get ulcers in their mouth as well. And then finally, because it is Oral Cancer Awareness Month, an ulcer in the mouth could be cancerous as well.
Oh, goodness. And I remember always being told that mouth ulcers, it's usually when you're run down, if you're tired or maybe coming down with something, as you said, that was the cause of it. So that is part of it?
Yes, so that will most likely be the type of ulcer that's called recurrent aphthous stomatitis. We don't really know what causes it. People do report these ulcers more commonly when they're sick or when they're run down. Especially if it's an adult that's getting these type of ulcers, it is worth checking if the iron levels, folate levels, and vitamin B12 levels are all okay, because people who are anemic may notice more of these changes as well. Although that being said, people can get ulcers and be perfectly healthy as well.
Is there something that we should know about if an ulcer could be more than just an ulcer? It could be something more serious?
Yeah, that is a great question. So generally, people who do have recurrent aphthous stomatitis, the ulcers tend to be multiple. So they can come up in little clusters, and they don't generally last for longer than 7 to 10 days. So those are your typical little round ulcers that come up. They go away after a few days. In some people, if they are quite severe, they can see someone to get it checked out. But if an ulcer has persisted for longer than 2 weeks, especially if it's a single ulcer, that should be examined.
Gotcha. Okay, so if it hangs around for longer than 2 weeks, time to check in with the doctor there. And
Yes.
I think you mentioned also that the type of toothpaste you use could be a factor?
Yes, so some toothpastes have a foaming ingredient called sodium lauryl sulfate, and we're not sure if it causes ulcers or if it makes existing ulcers worse. But what I generally do with my patients is that if they are struggling with these types of ulcers, I get them to go on a sodium lauryl sulfate-free toothpaste. So there are several brands on the market. So some of the Sensodyne won't have this SLS ingredient. Some of the dry mouth toothpaste like Oral 7, Biotine, even some of the newer High Smile ones don't have SLS as well.
Oh, okay, there you go. We're speaking with Dr. Amanda Poon-Nguyen. She's an oral medicine specialist, and talking about mouth ulcers this morning. And does everybody get them, or are they things like cold sores where some people get them, some people don't?
A lot of people do get them, particularly when they're younger. I think something like 40% of kids will do get them. Generally, by the time they reach adults, it would be less, so maybe about 10 to 15%.
Oh, okay. And, are there ways we can guard against getting mouth ulcers or try to reduce the amount we get?
Not really if you are the sort that is predisposed to these ulcers called recurrent aphthous stomatitis, because there is thought to be a genetic link. Sometimes it can run in families, but there are things that you can do to make them heal up a little bit faster. So to avoid any sort of irritating foods, you can buy numbing gels over the counter at the pharmacy to make them a little bit more comfortable. If they are these types of ulcers, they will generally heal up in a few days anyway. So it's just sort of keeping yourself comfortable and try not to traumatize the mouth too much. Generally, most ulcers will be minor, and if they are recurrent aphthous stomatitis and you're getting 1 to 2 breakouts a year, we don't worry about it too much. If you find that you're almost constantly getting oral ulcers, or as we talked about before, if any of the ulcers last for longer than 2 weeks, it is worth getting it checked out, because sometimes there are medications that we can do to make it a little bit more comfortable in the more severe cases.
Okay, so definitely worth mentioning or following up with a doctor if you're getting them all the time or if they're hanging around a long time. Well, that's all been very enlightening. Thank you so much for your time this morning.
Oh, my pleasure.
Dr. Amanda Poon Nguyen there, oral